This case example of topical steroid withdrawal, or TSW, is of Santiago Aufranc, who used a combination of topical and oral corticosteroids. My name is Hibba. I'm a dentist, I have a background in biomedical science, and I come from a medical family. I've personally been going through TSW and protopic withdrawal, and it was a struggle for many years before I found a doctor who was familiar with this at all. This meant that I was previously misdiagnosed with having severe and worsening eczema, and I was given medication which not only caused but then it exacerbated my condition, and this is currently happening to many other people right now. So in order to help raise awareness and to showcase the personal experiences, the symptoms and the patterns, and to help with recognition of this condition, these videos are presented in a format that medical professionals will be familiar with. I'm not giving any medical advice, and all photos and experiences have been shared with permission. Any explanation that I give of the TSW process is evidence-based, and for more information you can check Dr. Marvin Rappaport's website, where underneath the articles section you can see all of his papers which were published in peer-reviewed journals. You can also find him on YouTube discussing the same thing. Red skin syndrome is another name for TSW. So this is Santiago. He began his TSW experience in 2017 and it lasted for about 20 months. Some people take less time, some people around the same time, some people take more. He's 39 years old, he's from Argentina, and he is an English teacher and a travel enthusiast. He has a history of eczema, and he's allergic to fur and pollen. He doesn't have asthma. He does have hay fever, but he doesn't use medication for this, and he's currently not taking any medication at all, and he doesn't have medical conditions. He has used a combination of topical and oral corticosteroids, and we're going to have a look at that right now. As a child, he was diagnosed as having mild childhood eczema at the age of 5 or 6, possibly even younger, and this was so mild that he didn't need any medication. Then as an adolescent, he had worsening eczema, which meant he was bleeding on his inner elbows and knees after he was scratching. You can see in the photo how red his arm was. He was given a high potency topical corticosteroid cream, which is betamethasone dipropionate, by his doctors. No other treatment or medication was actually offered to him. He didn't use it consistently. Sometimes he would leave flares alone without actually applying any medication. When he was 21, his eczema got worse again. He was scratching more often, all day and all over his body, and his bedsheets was covered with blood. The steroids were not actually working anymore at all, so he stopped taking those, and because he noticed that he was stressed and feeling depressed around the same time as his flare, he began psychotherapy, and then his skin did improve over the course of a year. It may have been a type of withdrawal, as he was no longer using any steroids. The next 12 years, he had clear skin and he didn't use any medication. When he was 34, he lived in China and he was experiencing some minor depression and lack of motivation, around which time his eczema worsened again. He wanted to avoid his previous experiences, so he went to the dermatologist who gave him the same creams. This time, he made sure he applied it consistently as instructed by the doctor. They worked really well in the beginning, but every time he tried to stop or lower their frequency or potency, his skin would flare. And for the next 14 months, this was the following cycle that he found himself in. The doctors would give him steroids, he would get some initial relief, and then he would flare horribly whenever he tried to stop or reduce the amount of steroids. Then he'd go back to the doctors, the cycle would continue and repeat, and this happened multiple times with the same result each time. He was then moved on to a super potent steroid cream, which was clobetasol propionate. Again, it was the same story. Then he was given oral prednisone. This time, same story, except the rebound flares were actually more severe than before. And you can see in this photo, this is a very typical pattern of redness that is experienced in people who are going through steroid withdrawal. It's very different to normal eczema. When he was trying to taper, you can see he was flaring badly. The itch became intolerable. The skin became much more red and dry than ever before, and he experienced a very strong burning sensation, especially on his face and neck. And burning is something that is very typical in people who are going through steroid withdrawal. It's not something that you'd see in eczema. Some other photos to show how he looked when he was trying to taper and he was flaring badly. This saw him having to stand in front of the air conditioning and even hold a handheld fan directly in front of his face at work at all times because of how bad the symptoms were. He was already taking prednisone for such a long time, so this needed to be tapered, and he was doing this until gradually he was completely off the medication, despite the flares and the state of his skin. At this point, he said, life felt like a living hell. And here's some other photos around that same time period. still tapering, and you can see all the different skin changes that are taking place as well, and even excessive skin flaking and exfoliation. After about 14 months of this, he looked up his symptoms, the red skin, the burning. He looked up steroids as well, and he found out that this can actually happen as a result of overuse of steroids. He didn't actually read about steroid addiction and withdrawal at this point, but he lost confidence in the earlier doctor, and so he saw a different one. This doctor was extremely shocked at how Santiago had continuously been given steroids for about 14 months, so Santiago felt reassured at this. The doctor then gave him a cream which was prepared by the hospital, which didn't have a label on it, and Santiago noticed that he was still in the same cycle. So after 4 months of using it, he asked the doctor, does this cream contain steroids? And despite the previous shock, the doctor said yes. So then Santiago saw a different doctor who only prescribed more steroid creams, and very tired and angry at the situation, when he went home, he researched more and he discovered ITSAN online. And this is the first time that he read about topical steroid withdrawal, noticing that each symptom that he'd had matched it perfectly. So we'd already talked about the increasing severity of the itch, red, burning skin, spreading rashes, extremely dry skin, and he was unable to stop or to lower the strength or the dose of steroids without flaring very badly. He read a lot about TSW and realised that it's going to be an extremely difficult process, and indeed, for some people, they do have a very debilitating experience for at least some of the time. So he quit his job in China, moved back to Argentina into his mother's home, and there he quit topical steroids cold turkey and began his withdrawal process. The last 6 months just before he quit topical steroids, he was actually not having any breaks in between applying the steroids. This was all as per instruction from the doctor, so you can see that it's not actually an overuse or misuse issue from the patient here, but rather it's an overprescription issue. The first couple of weeks he didn't have any symptoms, then they rapidly worsened, and then he got new symptoms appearing. Again, he said he felt like life was hell on earth. So all the symptoms that we'd mentioned before, this time he'd also experienced oozing, insomnia, thermoregulation issues, swollen lymph nodes at various sites, open wounds for months at times, blurry vision, elephant skin, weight loss, hypersensitivity to new things, fabrics, water, creams, food and drinks, and unfortunately suicidal thoughts. He did actually see a dermatologist during his entire withdrawal, who was actually a friend of a relative, and he'd agreed to accompany him during his withdrawal process, despite not actually knowing about topical steroid withdrawal beforehand. He helped to give him some medication that helped him with sleeping, and he also tried to watch out for infections. He did offer steroids at months 2 and 3, which were the worst months for Santiago, but he refused them. And at the end of the entire withdrawal process, the dermatologist actually admitted that yes, steroids had caused this entire situation. Here you can see Santiago in month 1, where he was gradually getting worsening symptoms, and they continued to worsen until about month 4, you can see in this picture, where the symptoms stopped getting worse. In month 5, it remained serious, but it wasn't worsening further than this point. Most of the photos that Santiago took were of his face, although it should be noted that his entire body was actually affected in the same way throughout his withdrawal. He spent hours every day in the bathtub as the water was soothing against his skin, and immediately after getting out of the bathtub, while the skin was still damp, he would try to lock in the moisture with mostly Vaseline, but sometimes Aquaphor as well. Between months 6 to 9, he saw very slow improvement. It was not a linear healing process, as you'll see in the next few slides. You can see all of the excessive skin shedding on his laptop, and then the progression of his symptoms between month 6 and month 7. Here's how he looked in month 7. And at this point, when patients present to the doctor, a lot of the time doctors will consider this to be infection and they will treat it as such. However, in TSW, it's very normal for people to experience oozing and crusting. This can be mistaken to be infected eczema or impetigo, but most of the time it's actually unresponsive to antibiotics, as the cause for this is not bacterial. Just to recap on how steroids actually affect the body, part of their function is constricting blood vessels. Upon stopping the steroids, the blood vessels will then dilate, and plasma will leak out through the dilated blood vessels, which will collect as swelling a lot of the time, and also this will leak out through compromised skin as oozing. Plasma is naturally yellow, and then when it dries on the surface of the skin, it forms a yellow crust. They will normally go through cycles of oozing and crusting until the flare subsides. Normally, this doesn't happen in conjunction with symptoms of infection unless the person separately has an infection at the same time as TSW. You can see here month 8, not that much different to month 7. And in the middle picture here, after spending some time drinking rum and being around cats, he was very itchy, and this was as a result of spending a lot of time scratching. But then in month 9, he started to feel a lot better, and his flares became shorter and less severe. Here you can see in month 10, he's starting to see a lot of improvement. He wasn't yet fully healed, but he could start living normally again. He was still experiencing slow and non-linear improvement. In the photo on the right, you can see on his hand, the wound that had started to close up here was previously open for many months, and this again is something very common for people going through TSW. Here's how his hands looked in month 11. Some photos between months 14 and months 16. And he didn't have any photos of the setback that he had experienced around 17 months in. He experienced a flare that lasted about 3 to 4 months, where he had worsening of the itch, redness and dryness, but these were all significantly milder than his first year of symptoms. Then he made a full recovery of TSW approximately 20 months after stopping steroids. Now he only has very mild eczema located to his inner knees, sometimes his inner elbows and ankles. Doesn't affect his life, is not noticeable at all, and he can manage any scratch wounds using zinc oxide cream, which then makes it heal in just a few days. All of the other symptoms that he'd had and the increased sensitivities have now completely resolved, and he doesn't use any medication at all. Here's a few photos after he made a complete recovery. In month 25, he did experience some symptoms on his hand, as you can see, but then that cleared up after 1 month. And in month 27, he went backpacking in the Caribbean. His legs reacted to the heat, but this is now completely resolved. It stopped after he finished his trip. And now you can see 48 months after stopping the steroids, it's as if nothing ever happened, and he's enjoying traveling again. So what helped Santiago the most? He mentioned patience, optimism, and a positive mindset, arming himself with lots of information on TSW, Dr. Marvin Rappaport's online material, ITSAN, Facebook support groups, and support from friends and family. He also couldn't emphasize enough the importance of time. He'd actually mentioned it 6 times in this statement here. He said it was an extremely difficult process that did consume about 3 years of his life before and during the withdrawal. But he's left the experience now feeling a lot stronger, more humble, and more sympathetic with people facing any kind of challenge. So in that sense, TSW did feel like both a blessing and a curse. Now, Santiago helps with raising awareness, especially for the Spanish-speaking community. And you can see he keeps a blog, which is available in English and in Spanish. And if you'd like to see his videos, here's his YouTube channel. They are in Spanish, but he showed me how to get subtitles in any language. So you'd need to go into the settings, and because he's speaking Spanish, it will take you from off to Spanish auto-generated in the subtitles section. Then you need to click subtitles again, and then this time you'll see auto-translate. And then from there you can pick any language that you prefer. Here's an example of the English subtitles. There's some Arabic ones, and French, and there's many more. So thank you very much to Santiago for sharing your story, and thank you all for watching. I hope this has been helpful.